Okay, hello everyone, and welcome to the American Rescue Plan Act update webinar presented by the Colorado Department of Healthcare Policy and Financing. This is our 2025 update. I'm sorry, February 2025 update. And Taylor, if you can go to the next slide. And here is our agenda for today. We're going to give some general ARPA updates. We're going to talk about our closeout plan. A lot of our projects have already closed and we're winding down some of our ARPA work. And then we want to highlight a few of our recently closed projects we hope folks will be interested in. And then last, we'll do a website review. So Taylor, if you can go to the next slide. All right, so general ARPA updates. Taylor Ipock, who is a HCBS employee and one of our ARPA project support administrators, is going to give us a few general ARPA updates.
Thank you, Patrick. Hi, everyone. I won't spend too much time on this slide, but highlight a few of these numbers because I know they've been seen before. As of the end of January, we have closed 55 projects, leaving only a few left to complete that final closeout process before March 31st, which is when all of that funding needs to be dispersed. This number has increased from the last time we saw you in December from 33 projects, so we're making a lot of progress. And I will now hand it over to Phoebe, who is going to talk about some of our project outcomes and the cool insights we're going to have for you all moving forward. So Phoebe, I will hand it off.
Taylor. Oh my gosh, of all the times to have a frog in your throat. I'm ready for the next slide. So this is our little roadmap of where we've been and where we're headed. We closed out a lot of our project activities in September, and at the end of November had a lot of our invoices wrapped up, some final projects closing out at the end of December, and then we're going to head for full closure here in March. Where we're going to turn in our final quarterly report to the Centers for Medicare and Medicaid Services. Next slide. So here's a few of the things left on our list or just some good, I should say, interesting facts. 53 of our projects have closed as of the 20th of February. We have 8 additional projects that are going to close by 3/31, so the end of March. We're working on wrapping up some of our budget stuff so that we can figure out a plan for provider payments utilizing those remaining funds. And then we're going to work on some we're working on outcome documents that highlight our achievements of the 61 ARPA HCBS initiatives. So lots of like housekeeping work here at the end. And I believe I'm passing it back to Patrick, right?
Yes, that is correct. Thank you so much, Phoebe. And as Phoebe alluded to, we have we're currently working on some project outcome documents that will be publicly available. And Taylor, if you could go to the next slide, please. Just want to talk briefly about these documents. We're trying to make a document for each individual ARPA project. There's a total of 61. I will say some of these projects are somewhat complicated, and so trying to put the info in one page might be a little challenging. However, we want to highlight certain things. When we first started with ARPA 3.5 years ago, each of these projects were developed because there was a community need, whether that be within the workforce or for the members that are served or technology upgrades or whatever that is. So we tried to kind of provide a succinct statement about the community need and why the project was important. And then we talked about, and then this one pager will also talk about the impact. What did we do? And you're going to hear about some of these project impacts as we talk about some of these projects that were recently closed later on in today's webinar. And then finally, we don't want this to be a one and done thing. And so how are we going to continue this work forward? And that's one of the things we spend a lot of time kind of towards the end of some of these projects is how are we going to continue at least some of this work or a portion of this work. And so each project fact sheet will talk about what's going to happen going forward. All right, Taylor, if you could go to the next slide. All right. And so I am going to turn it over to Heather Johnson, who works on our supervisor for our workforce team. And we've spent a lot of time, energy, and resources recognizing that there was a need to kind of help our direct care workforce. And so Heather is going to talk about a few of our direct care workforce projects. So thanks, Heather.
Thank you. I am going to start off with ARPA 1.03, which is the Standardized Core Curriculum and Specialization. So the goal of this project was to create training modules that are standardized across the state. We used a universal worker approach, so they were suitable across different care environments and for different populations, and really wanted it to be adaptable for various care settings. So the training modules can be used for onboarding and for annual training. It can be used for direct care workers who are entering the workspace, and also for those interested in caregiving if they want to learn a little bit more about it, and for natural supports so that they are level set and have an idea of how to do certain things. Let's talk about transfers and lifts, how to do those safely. And so the modules cover a wide variety of skills and specializations. There's some on dementia, there's some working with children, working with folks with behavioral health challenges, and they are all available on our direct care career platform for free. And if we'll go to the next slide, I'll talk a little bit more about that. So ARPA 1.04 was to create a resource and job hub. So we have Colorado Direct Care Careers Platform. It is designed with a vendor, and there's a few states that are contributing to the development of that, Colorado being one of the three. So we really were on the ground floor of making a platform that can be used for job recruitment, job posting, job matching, for training, and also for connecting the dots with resource sharing. So that's where you will find our Colorado Direct Care Career Curriculum. We have 30 modules available on the site for that. As I mentioned, they are free to use. We also have 20 essential skills modules. These are more for foundational skills of entering the job field. If you're a first-time worker, helping to understand setting boundaries, since you're maybe working with a variety of people and some different roles. And we also have on this site 5 career path modules. These are to help show folks how starting in direct care work can help an individual gain the knowledge and skills they need to leverage into other roles within the healthcare field. Or you wanted to give some examples of some jobs that were maybe not so readily understood, like surgical tech or sterile processing. So we have a few different ones on there just to kind of give folks an idea of where they can take their direct care worker skills if they want to. The job, like I mentioned, does job posting and job matching. So we do, as the state, control who signs up as a provider to post jobs. So it is open to HCBS providers, PACE providers, long-term home health providers, and also our CDOS, or our participant-directed folks. So they can post open positions they have. They'll be matched with anybody who's on the site as an individual user who's looking for jobs. And just like individual users will be matched with potential jobs that they're interested in. And then either party on the site can take next steps with the platform to say, hey, I'd like to talk about an interview, or I'd like more information about this position. Also on the site, we have over 500 resources, really just kind of connecting the dots. These could be for an individual user to learn a little bit more about maybe a specific type of disability or a type of way to access some services. So think of maybe someone in a wheelchair having to navigate a short platform. How do you do that safely for you and for the individual in the wheelchair? Also have a lot of resource connection for training topics and for the individual user on connecting to things that they might need in their world. The Health First Colorado application, we have Connect for Health Colorado linked on there. A lot of resources, really searchable, just so folks can kind of see where can they go to get things that they might need in their own lives. I will say, as of today, we have over 500 individual users signed up for the site, 84 individual providers, and I believe 29 CDOS providers have signed up and posted jobs. So ever since we put the modules on, we've had a pretty robust and every week increased use of the site. I believe last time I checked, there were 1,400 modules that have been completed, individuals completing the modules. So that is pretty exciting. We really encourage people to go in there, check it out, create an account, and see what is there for you. We also like to link any sort of free trainings that we come across, and so you can get notice of those on there as well. We welcome anybody wanting to share ideas for resources. We would be happy to vet those and also link them on the site. And really just want folks to get in there, use it, and provide some feedback on how we can make it better. And then I will close out with another overview of some training we did. So on the next slide, we'll talk about what happened with our HCBS training fund. So big project achievements, we had 87 individual providers or training organizations that were our grantees, and 41 individual direct care workers who received grants. So these grants were for training that was to help support specialization or entry into the workforce or specialization within the direct care work. We had over 4,000 individuals trained, and just a few of the certifications that came from this training. We had close to 200 NADSP certifications, 715 certified nursing assistant certifications, and 153 registered behavior technicians trained through the individual grants. We also did some partnering with other state agencies on training. We worked with board certified behavior analysts on how to work with individuals who have moderate to severe challenging behaviors, because our goal is to support those folks in their home and community so they can rise and thrive, if you will. And so we're really happy to be able to provide that training, and to so many. We had 26 training courses that were focused on disability cultural competency, and this is for our behavioral health and healthcare settings to really help medical professionals understand how to support the entire person, and maybe not just for the specialty that they were trained in. So we're pretty proud of all the training opportunities that happened with this fund, and it's a lot of folks who had a lot of training that they can then take and use in their own careers, and that's really what the intention of that the whole fund was for. And so thank you for all of that. I appreciate being able to talk about all of our workforce efforts.
Thank you so much, Heather. And that's some really exciting things that you talked about. And you know, again, early on in ARPA, that was one of the things that we identified was trying to find ways to support our direct care workforce. And I think your team came up with some really, really creative things and things that folks can really use. So thanks for talking about those projects. All right, next we're going to talk about the emergency preparedness projects, and I'm going to turn it over to Max Winkler, who is in the Office of Community Living and led up a couple of these projects. So take it away, Max.
Cool, thank you, Patrick. I'm excited to share some updates related to these two projects, 7.01 and 7.02, which were both focused on emergency preparedness. Taylor, you can go to the next slide. So I'll start with 7.01. It was specifically geared around emergency response plans. HCBS partnered with the Center for Inclusive Design and Engineering out of the University of Colorado. They used to be known as AT Partners, for those of you who have been in Colorado in the disability world for a while. It was a really great partnership, and we divided this up into kind of two separate mini projects within the emergency preparedness realm. The first was these emergency response plans. So this section of the project really looked at developing materials and trainings for both providers as well as members and their families to help them be more prepared in the face of an emergency. After the pandemic, we realized that there is a huge need and gap in terms of knowledge and preparedness specifically related to emergencies like that, but also other similar emergencies like wildfires here in Colorado, or even power outages that are caused by high winds in the southeast corner of the state. So the intent of this section of our emergency preparedness project was to give people the tools that they needed from an education standpoint to be more prepared. So with the Center for Inclusive Design and Engineering, or CIDE, we developed a series of materials and trainings specifically geared towards this goal. Those resources were created so that they had some kind of enduring staying power as opposed to a one-off training that people could access. They did a lot of research around national standards for emergency preparedness and developed these tools and resources in response to that research. There was a learning management system created for the training courses as well as 5 live training sessions to go over some of the training materials specifically. And those materials remain available on the CIDE website. Next slide. The training specifically were geared again towards providers as well as family members and Medicaid members, HCBS members. They were delivered all over the state in multiple formats. We did them via Zoom as well as in person, and we posted all of those trainings on the website that CIDE continues to maintain. There's a link at the bottom of this slide for anybody that's looking at this deck. We did over 80 course opportunities throughout the state. Topics of these trainings included things like emergency preparedness, trainings for providers that were about planning, preparing, and responding, really looking more in depth at CMS or Center for Medicaid and Medicare Services guidance for providers on how to plan and keep agencies operational during an emergency so that they can provide safety and services to the clientele that we're providing funding for. We also did train the trainer type trainings for teaching others to be prepared, helping agency staff understand how they can train their frontline staff in an efficient manner to manage an emergency. And then we did some direct training to members and family members with topics like being your own first responder, prepare like nobody is coming, really designed to introduce a variety of topics that can affect an individual's ability to plan for an emergency, remaining safe and independent throughout the entire time. So we're really excited to have these available to folks. The Center for Inclusive Design and Engineering was a great partner, and they will continue doing this important work here in Colorado. And this was a great springboard to getting a lot of this content out there. Next slide. So the second part of our project was this member emergency preparedness, as we called it, as opposed to the more kind of training and educational material side. And this was really geared towards distributing actual devices into the community for individuals who had a qualifying need. So the first part of it was doing these battery backup power supply systems. So these are really cool devices. They are home battery backup power devices that store energy that's gained from the typical grid. So you plug them into your wall, but they store all of this energy in this device that you can have at the ready if you run into an emergency where there's a power outage. So several instances of power outage can occur, whether it's due to like a wildfire or a wind issue, like I mentioned, and these can be life-saving. So individuals who rely on durable medical equipment or other life-sustaining devices might be required to go into a more institutional setting, such as a hospital, should they lose power for any period of time. Something that if you don't have one of these needs, you might not think of, but it can be really damaging to your overall well-being and threatening to your life at the end of the day. So we really wanted to get these devices in the hands of as many people as we could that had a need. So we developed a project to essentially purchase these devices and distribute them around the state to those who met the criteria. Next slide. As a part of this project, preparing for this, CIDE did a ton of extensive research and in-person lab testing in their lab here at the University of Colorado, Denver, determining what the best battery backup system would be specifically for this use case. So using these DME or life-sustaining devices that the HCBS population uses, they created this interactive power calculator, which is available on their website. This is a tool that's been shared nationally and shared at conferences around the country, and something that's generated a lot of excitement, not only from the Medicaid community, but also emergency responders who are looking for ways that they can support their local communities to be more prepared, even if they're not Medicaid recipients. So the way that the calculator works is you can plug in different devices, the settings on that device in terms of how much power it uses, something that's available in common manuals or even on the device itself, how many hours a day you might use that device, and then you can add as many as you have. So if, for example, you use a nebulized medication and you have an air compressor that's delivering that medication, you would need to know how much power you need, not only to run that device, but perhaps also to run a refrigerator that stores the refrigerated medication that you have to use. So you can plug all that into this publicly available use calculator, and it will spit out a specific amount of energy required to keep you kind of in a safe zone for using that equipment for a period of time, and then match you with a specific device that can meet that need. So once we had this power calculator developed and we figured out which devices were the best fit, we began accepting applications to distribute these devices around the state. Next slide. So to qualify for these devices, applicants had to be an active Health First Colorado or Medicaid member, and they had to utilize life-sustaining equipment, as I mentioned. That was pretty broad. It wasn't necessarily just DME. It could include things like chairlifts, CPAP machines, nebulizer machines, like I mentioned, power wheelchairs or scooters that people need for mobility, wound care management, even things like refrigerators, and more common appliances that are necessary to keep medication and other important life-sustaining needs in their proper state for an emergency. We distributed over 1,700 of these batteries around the state. The battery that we went with for this project are the EcoFlow Delta Pro and the 782, or the EcoFlow Delta Max 2. They're slightly different sizes depending on the needs. And we delivered them to 55 counties across the state. So nearly every county in Colorado, including rural and frontier counties, had recipients of these devices. These are not cheap devices. They're typically around $3,000 each. They're really valuable, not only from a monetary standpoint, but just from a peace of mind standpoint. We heard from countless families saying that they could finally breathe easy, knowing that if they lost power, they wouldn't be forced into a situation where they have to leave home and go into a hospital, or even worse, suffer any sort of health consequences as a result of that emergency. The full project report is available on the CIDE website. It dives much more deeply into all of the information about these devices and how we distributed them. So I encourage anybody who's interested to look at that. And even more exciting, we have established these devices as a new option under the home modification benefit within several of the waivers, something that we were really excited about because of the positive feedback that we received related to this project specifically. Next slide. The final piece of these projects were emergency Go kits. So a Go kit is typically something that you have pre-assembled in your home or even in your vehicle that's created to give you some peace of mind if you do have to pick up and leave your home in a rush due to an emergency. For individuals with a disability, we wanted to make sure that these Go kits were capable of providing needs that are common among the disability population. So for folks that have difficulty with communication, we have dry erase boards, communication boards, earplugs for noise sensitivity, emergency blankets, fidget toys, first aid kits, medical flash drives so that you can have all of your medical information stored in a digital format that you can take with you and provide to a person that's helping you in the state of an emergency, and several other materials that you might need depending on your particular disability or need. So a good example of something that doesn't appear on this list is if somebody had a service animal, we would make sure that there were supplies in their Go kit specifically tailored to their needs that would help their service animal also be able to come with them in the case of an emergency. So we distributed 1,000 of these kits around the state. A lot of these kits went to the same individuals who applied for the backup batteries, but not all of them. They went to a broader array of individuals that didn't have necessarily the same life-sustaining equipment needs that the backup battery recipients had. So we were excited to get these out into the community as well, generate some awareness about the need to assemble these kits. These are things that anybody can assemble and put together, and CIDE is always happy to consult with anybody in the community who's interested in learning how they might put together one of these kits. So please do check out the report. If you're interested in learning more about this, you can always get in touch with us at the Office of Community Living, and we would be happy to provide more details. I'll turn it back to you, Patrick.
Thank you so much, Max, and thanks for talking about those two really cool projects. And I think those are a great example of kind of emergency planning, right? And, you know, just the importance of planning ahead and the importance of having what you need. And I think that, you know, both of those projects were really helped a lot of folks. So the next project, I tend to get excited about all the projects. I'm especially excited about this one, the Pilot Capable, because I think this is a great example of kind of using something that might be available and using it in a new and creative way. So I'm going to turn it over to Karina in OCL, who's going to talk a little bit about our Pilot Capable project.
Thanks, Patrick. I was one of the folks who worked on the ARPA 4.05 Pilot Capable, and happy to share some highlights of this work. I'll start by sharing what CAPABLE is. CAPABLE is an acronym that stands for Community Aging in Place, Advancing Better Living for Elders. It's an evidence-based program developed by Johns Hopkins University, and in capable interventions, an interdisciplinary team works with the participant to set goals and direct action plans that change behaviors to improve health, independence, and safety. It consists of time-limited services in a series of visits from an occupational therapist, a registered nurse, and a handy worker who work in collaboration with the program participant. Typically, this looks like 6 visits with the occupational therapist, 1 with the handy worker, and 4 with the registered nurse that occur over the course of 4 to 6 months and are conducted in the participant's home. A key component of this approach is that participants themselves drive the goal-setting process. Next slide, please. The Capable pilot was active from January 2023 to August 2024. The team developed a grant program to increase access to Capable services for Medicaid recipients aged 18 years and older, with a goal to support members to remain in their home. There were 2 grantees, Colorado Visiting Nurses Association, also known as CVNA, and Brothers Redevelopment, who provided access to Capable along the Front Range. The Capable program previously existed in Denver metro area, and through this grant, it was expanded to El Paso, Larimer, Weld, Park, and Teller counties. The project team also worked with a vendor, Colorado Labs, to evaluate the effectiveness of the Capable pilot in Colorado, and to also identify recommendations about potential ways to implement Capable as a Medicaid waiver benefit. Next slide, please. Overall, this grant had 368 Health First Colorado Medicaid members participate in over 10 counties, aged 18 to 98. Next slide, please. The evaluation showed that Capable had positive outcomes for a wide range of members. Some numbers on this is that activities of daily living, which are tasks such as grooming or dressing, decreased by 24%. And instrumental activities of daily living, which are activities such as money management or shopping, decreased by 21% through Capable interventions. Statewide implementation was evaluated as feasible. Capable promotes greater efficacy and accountability than the current home modification waiver benefit, and it could serve as a part of a 2-tiered home modification benefit. As far as sustainability, both of the original grantees have successfully secured limited funding from other entities to continue their Capable programs. And the department continues to work with the Capable National Team and Johns Hopkins School of Nursing to explore the potential of adding Capable as a service option within members' benefits within our home modification services. A small note that the full evaluation of this grant can be found on the ARPA website if you're interested in seeing more information. I'll pass it back to you, Patrick.
Thank you so much. And again, I think this is a great example of looking at a program and looking at it and saying, how can we serve different folks under this particular project or pilot? And again, kind of the importance of trying to help folks remain in their homes. And so this is another great project. Taylor, if you could go to the next slide, please. Yeah, okay. So ARPA website, again, and Karina kind of hinted at it. All things ARPA can be found on our website. There's information about these individual projects that we talked about today and other projects, all of our 61 projects. We also do quarterly report to the Joint Budget Committee of the Colorado Legislature and CMS, who's our federal partner. And then, we also have our monthly newsletter, and all of our webinars, I believe, are posted on our website. So, Taylor, if we go to the next slide, just want to thank folks for watching this webinar, and thank you for your interest in our ARPA projects and HCBS generally. And really appreciate you taking the time to watch this webinar today. And thank you very much.